talked about the fact that if a woman is depressed during pregnancy in itself, yes, if a woman has had a history of depression or other mental illnesses, because of the fact that depression in the pregnancy in itself is a stressful event, it puts them at risk of having a recurrence of the depressive illness after pregnancy.
Okay, now let's look at the onset. When should we start, or one should start getting worried that this may be leading to something else, apart from that brief period of worry? How long will the depression last for it to be tagged postnatal depression? Okay,
so for you to, usually it's relatives, who are with the woman that would be the first people, or sometimes the individual themselves will know. But you would see that there's a clear deviation. After delivery, it is normal, it may be normal, for a woman to feel some loss of appetite, to feel tired,
particularly if you have to wake up in the night to feed the baby, take care of the baby.
So it's normal to have problems with sleep, to experience a reduction in their libido. And then sometimes there's what we call postpartum blues, which occurs in as much as 70 of every 100 females, and usually would pass within hours or a few days. But if all of this begins to extend, up to a period of about 2 weeks, then the cause for worry. If an individual who ordinarily, she's becoming irritable more often than not, she's experiencing all these mood swings, then it's a source of concern. And there will be other telltale features, some of which I have mentioned earlier.
So if it's a week long, or months long, or a year?
Well,
in a year. I'm just trying to, so that maybe we can also talk about the diagnosis, because how do we know that, okay, this is postnatal depression? What are the parameters?
Okay, so there are, there are features that would suggest that this person may be depressed. Like I said, it would be, apart from the features, it will be a clear deviation. So because it's a mood problem, one of the major things you will see is that there's a problem with the person's mood, and it may be irritability. At little or no provocation, the individual is irritable. You find that they are persistently unhappy most of the time. The person comes across as unhappy. They may be withdrawn. They may be having lost interest in things that they would normally find pleasurable. There's a marked reduction in their energy. They're not sleeping well. Difficulty with concentrating. There's a reduction in their libido, loss of appetite. Sometimes there may be weight loss. And in extreme cases, they may be suicidal. And then you find that in relation to the baby, the mother usually has concerns. Like I said earlier, she may consider herself as incompetent, as not deserving to have that baby, that she doesn't care. She may not be able to take care of that baby. She may have concerns about the baby's health. So you find that she's complaining that, this baby is not breathing well, this baby is not feeding well, this baby is not growing well.
Even if that's not the case?
Even if that is not the case.
So she will have, that kind of thinking that it's coming within her,
yes,
and will agitate her the more.
Yes, so you would see all of these signs, and then you know that there's a problem.
Okay, if that particular person is brought to the hospital, what do you do as a doctor?
Well, so for us, any mental illness in the period after delivery is considered an emergency for us, because the goal for us is as early as possible. You want the mother and the baby to come back together. Because we are particularly concerned about the attachment between the baby and the mother and bonding. So a few things I would have to do. The first thing is to assess and be sure that you make a proper diagnosis. Be sure that there are no other physical problems, maybe other complications after delivery that may be explaining or clouding what it is that we're seeing. And then following that, we want to do some investigations and then treatment.
Investigations in terms of
well,
what?
Maybe blood workup tests and all that. I mean, again, just to be sure that there are no other underlying problems or illnesses that would explain. I mean, because let me put it this way: if an individual has cancer, for instance, I mean, it may not be out of place for them to feel tired. It may not be out of place to feel should not have appetite, and all that. So you want to be sure.
To rule out every other.
You want to rule out every other
condition that may be present.
And then when you are sure that this person is depressed, we go on to treat.
Okay, now, outside of Nigeria, there are different figures from different countries as to the number of women who come down with postnatal depression. But if we look at figures from the World Health Organization, which says in the general population, talking about depression now, it's over 300 million people. So if we come back to Nigeria, and particularly talking about postnatal depression, how much of it do we see in our environment that should warrant us to, focus more in that area?
So, I mean, depression is, in the postnatal period, is quite common in this environment. And depending on where studies were conducted, we've seen figures as high as 14 to 15 of every 100 women, to as high as 22 of every 100 women that you sample. Again, depending on where the region. So one study in the East reported that we have 22% of women in the puerperum, that's in the period after delivery, have depression, while in this part of in the West, studies have reported figures as high as 15% in the puerperum.
Okay, in the West.
Yes.
So it's a common thing.
It's a common thing.
How is it being addressed? Maybe you answer that when we come back from this break. We'll take a break now. When Health Matters returns, it will be time for you to join us in this discussion, sharing your questions and comments by calling us on 080-805-42233 or by sending your tweets to CTV@_yomi or. Just stay with us.